Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, the BC's Provincial Health Officer. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nation. As you know, we'll be briefing here tomorrow in the press gallery at 3 o'clock. And then Friday, there'll be a written statement on Good Friday. And then Dr. Henry will be giving a briefing at noon on Saturday. And with that, I'm honored to introduce Dr. Henry.
Thank you and good afternoon. For today's BC update of COVID-19, we have 45 new cases that tested positive, who tested positive in the last 24 hours here in BC, bringing our total to 1,336 people in the province who have a test positive. That includes 615 people in Vancouver Coastal Health, 487 in Fraser Health, 81 on Vancouver Island Health Authority area, 130 in the Interior Health area, and 23 in Northern Health. We have no new long-term care facility outbreaks. It remains at 21. However, we do have some new cases, and we're up to 226 people in long-term care or assisted living who have tested positive, including 138 residents and 88 staff. Right now, we have 135 people who are hospitalized in British Columbia. That's a slight decrease in the last 24 hours, and 61 people in critical care or ICU. And that as well is a decrease of 5 people in the last 24 hours. Sadly, we continue to have deaths from COVID-19 in BC, and there were 5 recorded in the last 24 hours, bringing us up to a total of 48 people who have passed away in British Columbia from COVID-19. And unfortunately, it continues to differentially affect our elders who are in long-term care, including 2 people who died for the first 2 deaths in Amica, Edgemont, one of the long-term care homes that has been experiencing one of the outbreaks, and an additional person in the Lynn Valley Care Centre. And our hearts as well go out to those people, their families, and the care teams in the long-term care homes who are doing so much to try and protect and care for people. We now have 838 people who meet their criteria for recovery and are no longer in isolation in British Columbia. A couple of things I wanted to bring up today quickly. You would have heard at 1:30 today that the Premier has announced that we are stepping up our partnership with our Canadian Border Service Agency and the quarantine service at our land borders, and we will work together to support each other to continue to ensure that we can flatten the curve of this outbreak here in British Columbia. And that includes making sure that we don't have gaps in our firewall. And part of that is ensuring that people who come back from traveling overseas who have a risk of being exposed to COVID-19 because of those travels are able to join our firewall to make sure that they have the means to do what they need to do to self-isolate for 14 days when they come back to best protect both themselves, their families, and our communities across BC. So the piece that we are adding, you would have heard today, is ensuring that everybody who comes back has an approved self-isolation plan that they attest to and that they sign off on, and that we are there to support and welcome them and make sure they have the means and the things that they need to be able to adhere to this self-isolation plan. And that may mean for some people that they spend some time in our quarantine facility that we'll be partnering with the federal government on until the important pieces that they need are in place to be able to self-isolate effectively at home. For many people, for most people, I'm sure, it will mean that they go directly home and that we're able to support them by providing things like groceries, medications if needed, and other things to make sure that they are able to effectively and safely care for themselves and to self-isolate in their community. We also are going to be doing regular check-ins on everybody who is in self-isolation to make sure they have the things that they need to continue to follow the measures that we need them to take, and that they are able to be connected quickly to health services if those are needed, and they know who to contact should they have needs arise while they're in self-isolation. And I want to thank particularly the many community organizations and public servants across British Columbia who've stepped up to be part of this initiative. It's a really important thing that we can do to welcome home our fellow people from British Columbia and make sure that they have the means to stand with us and make sure we're doing all that we can to continue to prevent transmission of this virus in our communities. I will also mention, as we're coming up to the long weekend, that we've said this before and we'll say it again. We need to stay home this weekend. We need to be close to our families, to the people that we share our homes with, and we need to reach out to others virtually and stay connected. But this is not the time to take unnecessary travel. It's not the time to go to some of our smaller or more remote communities where the services may not be available to support you or to support the community should this virus be introduced into those communities. And we need to make sure that we consider the impact that such a misstep could have on everything that we have done and everything that we have put together in the last couple of weeks, and to make sure that we continue to keep our firewall strong. So we are in this together, and I've said this week every day, we are in the thick of it right now. We are still watching what's happening across the country and across the globe, and it is no time for us to let up at all. And I want to thank everybody for who's doing their part, and others who may find this challenging. But this is the time where we can be together to support each other in being able to do what we need to do right now. And that's all about safe distancing between us, not connecting with people physically, but connecting with them virtually, making sure we're supporting each other, making sure we're doing the cleaning our hands regularly, covering our mouth, and staying away from others, particularly if we're not feeling well ourselves. So every day that we are doing this is making a difference. It's making a difference in our communities across British Columbia. And this is our time to continue that, to care for each other, to bend the curve together. And as Minister said yesterday, bend the curve, not the rules this weekend. It's a time to continue what we have been doing, being kind to each other, being calm, and being safe.
Thank you very much, Dr. Henry, and I wanted to, first of all, join Dr. Henry in my condolences for the family, for the friends of the 5 people whose deaths we announced today from COVID-19 in BC. It's 3 of them in long-term care, and this is shows, I think, the difficult nature of COVID-19 for families, and we want you to know that we're with you, we're supportive, we see your grief, and it's one of the things that I know drives Dr. Henry, but everyone involved in the provincial health team, because we know what it means to people. I wanted to also say, as Dr. Henry said, we have 1,336 positive tests in BC, 45 more today, 838 recovered people in British Columbia, all of which is positive, especially the latter, showing that the supports that many doctors and nurses and people in public health have given to people who especially are resting and getting well at home have been, in many cases, hugely successful. I want to acknowledge all those people who work in the community. We think a lot about the possible impact, and we model about the possible impact on acute care, but we know the value that divisions of family practice doctors bring to them, and we want to be supportive of them in every way that we can. We have 135 people hospitalized from with COVID-19 in BC today. That's 48 in Vancouver Coastal Health, 62 in Fraser Health, 10 in the Interior Health Authority, 11 in the Vancouver Island Health Authority, and 4 in the Northern Health Authority, and that's down from the high point, which I think was 149 on Friday or Saturday. We have, of course, as you know, opened up, and there are many empty beds in acute care, 4,514 today, which is roughly what it was yesterday. That's a level 58.5% full right now of capacity. In critical care units, it's under 50% or 48.8%. Wanted to express my appreciation for the Premier's announcement today of more supports, of significant supports for people returning home to Canada. I think our message is very clear that the day British Columbians come back to British Columbia is the day they have to join with the millions of British Columbians, all of the people in public health, in joining the fight against COVID-19. And part of our effort is to support them in doing that and to ensure that we don't introduce COVID-19, that we can, at this stage in the process when we're doing so much work to flatten the curve, and that all of the people who return home, as we would hope Canadians to return home in difficult times, are supported in their efforts to self-isolate for 14 days without exception at all. And I want to particularly express my appreciation to the Premier who led this effort, to Minister Farnworth, to all of the people supporting their efforts. I want to acknowledge the support of Ravi Kahlon, an MLA, who's one of our MLAs who is part of this effort. I want to acknowledge federal officials like Minister Qualtrough. One of the things we try and do is appreciate people who are working, especially working in healthcare right now. I just wanted to acknowledge someone who I've had the opportunity to listen to by conference call almost exclusively in the last little while, Dr. Teresa Tam, our country's Chief Medical Officer of Health. I think I almost certainly speak for Dr. Henry. I know I speak for Dr. Henry when I say that I think I've come to count on her thoughtful, intelligent, generous, and strong approach. She's a remarkable leader, and I wanted to express my appreciation to her and all the people working with her for all the work they do every day. I want to also acknowledge the people who are rejoining the profession, now 58 doctors, now 947 people in nursing, including everyone from RNs to nurse practitioners to LPNs to registered psychiatric nurses to care aides who've come back to the profession to help us at this difficult moment, the 38 allied health professionals who have done the same. And finally, I want to note Minister Heyman announced it today, the closing of BC parks for this weekend especially, which is important. People need to not travel this weekend. I had the opportunity to talk a little bit to my colleague from Alberta, Tyler Shandro, about this today. I think it's important. We admire our neighbors just as we admire people in Washington State. We admire our neighbors to the east, Easterners in Alberta, and we have deep and historic ties. But this is not the time for people from British Columbia to visit Alberta, for all of the reasons to visit Alberta. It's not the time for people to Alberta to visit British Columbia. It's not the time to be traveling to second homes. This is the time where all of us need to flatten the curve. And so I want to strongly, strongly encourage people to stay home, to not travel unnecessarily this weekend. There's sometimes, and lots of people for essential work who need to travel, we understand that. And for all of those celebrating all of our religious holidays this weekend, Ramadan to Passover to Vaisakhi to Easter, and to those who don't, for them, at the very least, spring is a time of renewal. And this will be a long weekend like we have never experienced. Its religious and family significance is as strong as ever, but we must find different ways to make it memorable, restorative, and affirming. Find the virtue in virtual and telephone connections. Find togetherness without gathering. Find comfort in your own home with your family. Embrace the renewal this weekend offers us all. And with that, also renew your commitment to all the actions we need to take together, all of us, every single one of us, to stop the spread of COVID-19. Remember all that Dr. Henry has asked of us. It's all important, and it's done because this is our effort, our fight, our action together to bend the curve. We have to be 100% all in, and we especially have to be 100% all in as we go through this long weekend. Thank you very much, and we're happy to take your questions.
Okay.
En français? Quelques mots en français? Oui, bien sûr. Je l'oublie de temps en temps. On a aujourd'hui 45 nouveaux cas de COVID-19 en Colombie-Britannique, pour un total de 1336 cas en Colombie-Britannique. Malheureusement, il faut annoncer qu'on a eu depuis hier 5 nouveaux morts de COVID-19 en Colombie-Britannique, ce qui est une tragédie pour ces familles, tragédie pour tous ceux qui travaillent dans le système de santé et tragédie pour toute notre communauté. Et donc, on veut reconnaître ces familles et ce dont ils souffrent actuellement. Il faut dire que maintenant, on a 4514 lits ouverts en Colombie-Britannique dans les hôpitaux, partout en Colombie-Britannique, ce qui est un fait extraordinaire. 42% des lits sont ouverts actuellement, sont vides actuellement. Donc ça, c'est un changement important. Et surtout pour ce week-end de Pâques, il faut que tout le monde, si ce n'est pas nécessaire de ne voyager, que tout le monde décide de ne pas voyager ce week-end. C'est absolument nécessaire pour notre effort, pour qu'on puisse être 100% dans la bataille contre COVID-19. Merci beaucoup, and we'll take your questions.
Thank you. As a reminder to everybody on the phone, please press star 1 to enter the queue to ask a question. You are limited to one. And please take your phones off mute. You will not be audible until we call your name. First question today is from Binder Sujin. Go ahead.
Hi there. I just wanted to check. Out of Ontario, we heard that they had a testing capacity that was greater than what they were actually doing in terms of tests, and the Premier there has asked for more tests. And I'm just wondering, in BC, as our capacity grows, are there plans to increase tests? Because I think at one point you said that was sort of on the to-do list long term.
Yes, absolutely. And our capacity has grown, and our testing has decreased with the focus on people at higher risk. I will also say that the number of tests that being done has decreased for other reasons as well, and part of them is that we're not seeing as much respiratory infections in the community right now. So when we were doing, early on, when we were doing the broad testing that we were doing, our positivity rate was less than 1%. It was around 1%. It's now quite a bit higher. It was 6 or 7%. So that does tell you that 95 to 99% of the people who are tested do not have COVID-19 or don't test positive. Yes, we have changed our strategy as we've seen the numbers decreasing in the populations that we've been targeting over the last 2 weeks in particular. We're starting to increase the number of people that we're testing in the community, and for physicians to be able to test more broadly now as well. One, because we have the capacity, but also because as influenza goes away, anybody with a respiratory illness now has a higher probability of potentially having COVID-19. So it's been the strategy, and I think I've mentioned it many times, that we will change as the epidemiology of what's happening in our community across BC is changing. So we do expect that our testing numbers will go up again in the near future, and we'll be looking again at making sure that we're identifying any clusters in our communities. We're still doing that, and particularly in areas of the province where there's not been a lot of community transmission, that has been the focus, but I expect will increase over the coming weeks.
Next question is from Vaughn Palmer, Vancouver Sun.
Minister Dix said yesterday that about half of the deaths, I think around 24, occurred in associated with the outbreaks in just those 2 care homes, long-term care homes in Vancouver. And Dr. Bonnie Henry said yesterday that I believe there are no outbreaks in any long-term care homes on Vancouver Island, even though demographically Victoria is sort of ground zero for the aging population in Canada. I wonder if you could offer any insights into how or why the problem got so out of control in those 2 homes in Vancouver, and how, conversely, it managed to avoid any outbreaks here on the island.
Yeah, I wish I knew. There's a couple of things. One is we know that cases were transmitted in the community, and there was an increased pressure of transmission in the Lower Mainland compared to the rest of the province. Part of that had to do with the population. That's a much higher population, the population density, but also our proximity to Washington State and the introductions of quite a lot of people, both people traveling back and forth and people from Washington who came to British Columbia. So the challenge that we had and the initial outbreak in the Lynn Valley Care Centre is representative of this, is that it was a very mild illness in many people, and so the outbreak was not detected at its early stage. It was well advanced by the time it was recognized, and it's unfortunate. I mean, it's really challenging for us. It was during influenza season, where people are heightened awareness of respiratory outbreaks and influenza-like illness in those communities. But there were, in retrospect, quite a few people, both residents and staff, who were affected by the time it was recognized. And this just shows us how challenging it is to play catch-up with this virus when you don't detect an outbreak early. And we have that same example from Washington State, where they had a number of care home outbreaks as well. And as we know, there's nothing we have right now to prevent transmission or to prevent you from getting sick after you've been exposed. And we've come to recognize how challenging it is to manage these outbreaks, particularly with people having mild disease. So that's, that is unfortunately what happened both in Harrow Park and in Lynn Valley. I think we learned, though, across the province from what happened, particularly looking at Lynn Valley, and we've taken a number of measures in all long-term care around the province to ensure that we heighten our awareness, that we focus testing on those areas to be able to detect it early. We've put in measures around healthcare workers not transferring between different facilities as frequently, and that is something we're doing across the board as well. But all of those enhanced measures have led to very few cases in most of the other outbreaks that were detected very early, and is one of the reasons why here on Vancouver Island and in the rest of the province, all of the long-term care facility outbreaks we have are in Fraser Health or in Vancouver Coastal. So I think it's a testament to learning from the initial outbreaks, learning from what happened in Washington State, and trying to do the best we can to protect that very vulnerable population of our seniors and elders in long-term care.
Next question is from Moira Warburton from Reuters. Go ahead.
Hi, Dr. Henry. I realize you touched on this in the past, but I'm wondering if you can expand a little bit on what you think helped BC to apparently flatten the curve so far.
Yes, well, so far, and I think that's the really important thing is every jurisdiction is experiencing their own pandemic, and ours has really been driven by our long-term care facility outbreaks in the Lower Mainland. I think the things that helped us, perhaps, and it's impossible to compare. Part of it is timing. When our March break was, learning from what we were seeing in other places. Particularly, Quebec's March break was a little bit ahead of ours, and we saw the impact of what was happening there. We also very much were affected by what was happening in Washington State. So part of it, I think, was our early testing strategy, having a very wide net for testing and being able to pick up. And part of it's preparedness, part of it is timing, and part of it is quite frankly luck. But I also think right now what we've been doing in the last couple of weeks, and the buy-in from everybody in all communities in this province has made the difference. We know that washing your hands frequently makes a difference. We know that keeping that distance between us, that safe distance, so that we're not spreading our germs, makes a difference. We know that not having indoor group meetings where we have the potential for having prolonged contact with somebody who may have very mild symptoms, and we learned this from Germany, we learned this from other places, from what we heard from Wuhan, that if you're in close contact together, even somebody with very mild symptoms or early before their symptoms start can spread it. So we tried to learn from what was happening around the world and put that into play here, but I really think it also comes down to the fact that people in BC recognize that these were the things we had to do now, all of us, to break that transmission and to protect our communities and our families.
Next is Victoria Chang, Ming Pao. Victoria? Okay, moving on. Justine Hunter, Globe and Mail.
Thank you. We learned earlier this week in one of the briefings that we're at a phase 4 in terms of PPE levels, and that means that at least one item will be depleted within a matter of days. I'm wondering if you can confirm if that one item is N95 respirator masks, and can you bring us up to speed on what your quality assurance measures have been finding? Has our testing revealed any problems with the masks that BC has obtained so far?
Yeah, so when we moved to phase 4, it was because of concern about, there's a whole bunch of factors there, so it wasn't one single thing. It was about needing to preserve all of our personal protective equipment. At that point, we did have grave concerns about our respirator supply, but we also knew that we were burning through quite a lot of regular medical masks. We had issues with gowns. We had issues with face shields as well. So it was recognition that we needed to move very quickly across the health sector. So everything from pre-hospital care, paramedics, our other non-paramedic responders, making sure that across the system we were doing everything we could to preserve PPE. It was not just one thing. It was also recognition that what was happening globally would affect us, and we needed to take action quickly to preserve our long-term supply at the time that we were actively going out and trying to procure the supplies we needed across the board from around the world. And we've had amazing businesses step up, as you've heard, both across Canada and here in BC to support this. So far, the testing that we've done has not revealed any concerns that I'm aware of, but there's more to be done. So we don't actually know yet. Some of the supplies that recently came in are still undergoing the process.
Yvonne Raymond, CTV.
Hi, Dr. Henry. We're hearing from Victoria construction companies that they're worried some of their workers have COVID-19. I guess they're sending their staff home, but they're still expected to keep up with projects, and of course, they've been deemed an essential service. So for the workers who have symptoms, can they not be tested to ensure the safety of everyone else?
Yeah, so any worker, any essential worker, anybody who has symptoms does have the ability to be tested, but the first thing that they need to do is isolate from others so that they're not passing it on. And we don't want people working sick, whether they have COVID or whether they have something else. So there is a process that involves being assessed about whether testing is needed, and it depends on the symptoms. And for all of the essential workers, the first and best thing that we want people to do is to self-isolate, stay home, stay away from others if they're sick until they recover. And if they need health care, to come into our health care system. But if there are, so it depends on whether there's essential mission critical people. So that is what I would say for any construction company, for any grocery store, that you need to support your workers to stay home if they're sick. They should not be coming to work if they're sick. It's only if there's a key person that is the only person that can do that job and they absolutely have to be there that you want them to be in the site. And we have that in some of our healthcare settings, for example, or key people that on a fire service or a police service. So the bottom line is, testing or not, people who are sick should not be at work.
Ethan Sawyer, CBC.
My question is, does the province need to change its procedures when it comes to checking up on people who are infected with COVID-19 while at home? I'm asking because BC has now seen 2 people die at home who were relatively young. Should people be coming into the hospitals instead of staying home so this doesn't happen?
Yeah, obviously we are looking through all of what we're doing to support people who are self-isolating at home, trying to make sure if there are risk factors for, as we're learning about this virus and how it affects people, we have been learning there's a critical period of time, usually in the second week, so around day 5 to day 10. And we see that with, for example, the Prime Minister in the UK, in Britain, where some people will just be getting better and be fine. Other people can very quickly go downhill. So that's a critical period of time where we do want to make sure that anybody who has any concerns gets the health care that they need. We do have processes where we have daily follow-up with people who are ill, who are known to have COVID-19, and we need to put the message out in a more, perhaps in a better way around people who are self-isolating because they've traveled. If they have any concerns, and we do give this message, but we need to say it again, if you have concerns about shortness of breath, if you have concerns that your fevers and your feeling unwell is not resolving, particularly after 5 to 6 to 7 days, then call 811, call 911 if you can't breathe, if you're feeling short of breath, if you have chest pain. It is important that people know that these are signs that you need to seek additional help.
Just one very small additional point. We've added enormous resources to 811. That the average wait time at 811 yesterday was under 30 seconds. And so people should feel they can contact 811, they can get in touch with the healthcare system, talk to their family doctor. Many of them, most family doctors are engaged in virtual care now. So there are ways to support people in the home, but I just wanted to bring the 811 figure because the people working there have been doing just an extraordinary job.
Next question, we're going to try Victoria Chang again. Ming Pao.
Oh, hi, Dr. Henry. I'd like to know for the new 5 days, 3 are the seniors residing in those long-term care homes. But can you give us more detail about the other 2? Are they young? If they die at home for these 2 more new deaths?
I don't have the details on the other 2 deaths that we're talking about. One of them was in the Fraser Health, the other in Vancouver Coastal. My understanding is they were in hospital, but I'm not entirely sure on that. The age remains elderly, people over the age of 70 in particular.
Next question, Richard Zussman, Global News.
For Dr. Henry, how do you respond to families of seniors living in independent living facilities who say the province isn't providing PPE or infection control staff in the case of an outbreak and are worried staff are still allowed to work at multiple homes?
Yeah, so independent living homes are different than long-term care facilities, and they're where people are exactly that, living independently. They tend to be healthier. They tend to be able to self-isolate. For example, we do have a program through public health to connect with people in independent living, to provide them support, and we've been working very closely with them across the province to put in place the measures as you would in an apartment building or a home. So there are some things that they do communally that may not be appropriate during this period of time, for example. But it's not the same situation as the people who are requiring care in a long-term care home. So it's a very challenging situation. There's not an easy answer to any of this, and we need to put protections in across the board for people who are more vulnerable, including people with disabilities, our elderly family members and seniors in our community. And I know we're trying to do that as best we possibly can in all those settings.
Mary Griffin, Check News.
Hi, thanks very much for this. Just wondering, Dr. Henry, you said you were going to come out, I think, with modeling again next week. And I was just wondering, with the new cases seeming to plateau or even decrease some days, at what point would you anticipate bringing back some of the services to hospitals, such as maybe reintroducing some of the elective surgeries?
Yeah, those are the questions that we've been talking about in detail and planning about in detail over the past weeks. Well, quite frankly, and I've said this before, since the moment we put on these restrictions, we started thinking about how are we going to lift them and what are the key things we need to know that it's safe to do that, and how would we start and where would we move. And I know we've talked about some key people, wise people have come in to help us with those, including Michael Marchbank, who's a health leader who's been part of the system in BC for a while. There are ongoing conversations, and we'll talk more about it next week when I show you what we're working on. But I was on a conversation again this morning, one of the national calls that I am part of, where we had, what is the goal? What are the key pieces of information we need? For example, what's the evidence around children and how children get this virus and spread this virus or not spread this virus, and pulling those evidence reviews together to inform our decision for when it might be safe to restart in-classroom schooling, for example. So all of those questions are being worked on. I don't have the answers today. We will be coming up with some thinking and plans. We'll also, I've been talking with our modelers, particularly our team at CDC, about what are the key things that we'll need to watch to see if restrictions need to increase maybe in the future, if we start to see a lot of community transmission again. So it's a balancing game for the next few weeks to months, but our aim is to try and increase and get back to what we can do in a measured and thoughtful way as soon as we can.
Next question is from Les Lane, Times Columnist. Go ahead.
Oh, thanks. About the requirement for self-isolation plans from all Canadians returning home starting Friday in BC. I got an estimate of about maybe 600 international travelers a day now going through YVR. And I think Global Affairs Canada has a couple 100,000 Canadians still registered abroad. I was just wondering if you expect that traffic count at the major crossing YVR to continue like that, and what's your estimate of what that count will do over time?
Yeah, so we've been watching that very carefully as well. It has decreased. It was in the 2,000 to 3,000 over the last couple of weeks. We're also looking at land borders and the land crossings. We know that Canadians are still looking to come home, and rightly so. This has been a challenging situation globally, and we want to be able to best support people who are coming home to BC to make sure that they can do what we need them to do, what all of us need them to do. So that's what this initiative is about. I suspect that we've also been working with the federal government. There was flights coming into both Kelowna and Victoria from areas in the U.S. in particular, and those will all be now diverted to YVR to make this an easier process for us. We are hearing that people are continuing to come back, and as a matter of fact that there's a groundswell of many people in the U.S., for example, wanting to get home as the crisis continues there. So I suspect the numbers will fluctuate, but I would not be surprised to see them increase over the next couple of weeks, but I wouldn't imagine that they would explode. It's still a challenging time for travel right now globally.
Keith Baldry, Global News.
Based on our knowledge of how fast this virus presents itself, when do you think we'll know whether or not enough people followed your direction this weekend and did not gather in large gatherings and basically stayed home? And secondly, any update on the clusters in the group homes you referred to yesterday?
I don't have any update on the clusters in the group homes. I know they've been going on for some time. I understand there's no increase that I'm aware of. In terms of when will we know, that's the challenging thing, because we know the incubation period is up to 2 weeks, but most people start to become ill within 4 to 7 days. So we will be getting through next week and watching the numbers and watching how things go, looking at our testing, looking at the public health contact tracing and follow-up we're doing in our community very carefully over the next 10 days. We are, as I say, in the thick of of things here, but they are also in the thick of things in Ontario and in Quebec. And we're seeing increases across the prairies. Alberta and BC are similar in terms of where we are perhaps in our trajectory. We're also seeing a lot of increase continually in cities in the U.S. So it's all going to factor in to what's happening in the next 10 days.
Okay, we have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon with all the information covered off today. For recommendations on protecting families and communities from COVID-19, please visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Shannon Waters.
Hi, I am wondering, yesterday we had talked about the testing of hydroxychloroquine, I think I got that right, as a potential treatment for COVID-19. But I'm wondering, based on sort of the instability of the supply globally, what we've seen with India and the actions that the U.S. has taken, what steps the province might have taken to ensure that British Columbians who are normally being treated for various conditions, including lupus, with that drug, to ensure that they continue to have access to that supply.
Yeah, so hydroxychloroquine is a drug that we've had around for a long time, but as you indicate, people with lupus and rheumatoid arthritis do take it for treatment on an ongoing basis, and it's quite effective. It's a relatively new use of that drug, which is an anti-malarial. So yes, Health Canada has taken steps several weeks ago to ensure that we maintain our supply and that there's not a run on the drugs as well. We have provisions in place in the province and across the country to monitor and restrict the amount of access to certain prescriptions, and this is one where we're watching it very carefully, and there has to be a justification so we can access it. It's an off-label use. It can be accessed only under the special access program currently, or so we're trying to put those balance measures in place to make sure that those who need the drug on an ongoing basis still have access to it.
Okay, I think that's all the time we have for today.
Right.
Thank you.
Thank you. Enjoy the sun and stay apart.
Exactly.